Thank you very much for coming to the All Pulp, No Fiction Dental Podcast.
Yeah, thank you for having me.
You're our first Japanese guest in a while, so we are very happy to have you. So usually dentists who visit from outside of Japan come here and we have the chance to actually meet them because everyone in here is actually quite busy. And you are also like quite busy, so you just came back from the States, right?
Yeah.
How was your trip?
Yeah, it's good. I spent 3 months
3
in
months
the
over
US.
there. Okay. What were you doing over there?
I gave a seminar in more than 10 universities.
Oh,
and
that was like
more than 100 people
to
discuss about my research and their researches.
Yeah, so we're going to get into that a little bit later. You just published a paper in a very famous Nature, right? In a very famous journal, right? And we're going to discuss that. But before, let me introduce you a little bit to our audience.
Yes.
So I know you graduated from Showa University.
Yes.
Where you got your dental degree.
Yeah.
Then got your PhD from Tokyo University.
Yes.
Did a couple of fellowships. Were the fellowships also in Tokyo University, or did you also there? Then you got your assistant PI, associate professor, then came back to Showa University, right? Other than that, if you want to introduce yourself to our guests, how would you introduce yourself? Something that is not just written over here.
Yeah, I'm a dentist, and my research area is called osteoimmunology. Osteo means the bone, and immunology is immunology. So the osteoimmunology means the research field that combines bone biology and immunology. So that's my research area.
That's your research area. If I might ask you like a weird question, but you became a professor at a very young age, I think around 36 years old?
I'm now 36. Became 36 last week.
Yeah, so happy birthday.
Thanks.
A bit late now. So what's the secret to becoming a professor at this young age?
Yeah, I haven't figured out if becoming a professor at a younger age is good or bad.
Well, there's a time to figure that out.
Yeah. But it's thanks to the people around me, especially my previous mentor, Dr. Hiroshi Takayanagi in the University of Tokyo. He's the pioneer of the osteoimmunology field. And his lab is really, the world's top lab in the field of osteoimmunology. So I spent 10 years in his lab, and I was trained by Hiroshi Takayanagi. And I was lucky enough to work with very talented or motivated scientists in his lab. And thanks to their, effort and collaborating with me, I was able to publish papers in prominent journals like Nature or Nature sister journals. And I was able to get big research grants. So that's a reason why I was able to be a professor at this age, but it's totally thanks to the people around me.
What you mentioned is like something that a few of our guests also quite mentioned, like mentorship and, the people around you are quite very important.
Yeah.
Also, like being able to publish in these very famous journals is quite a difficult task without, actual good environment that helps, publishing. So can you get a little bit deeper into, not deeper, like deeper enough for us to understand about osteoimmunology? Like, what is osteoimmunology and what got you interested in this field, generally speaking?
Yeah, okay. So osteoimmunology, as I told before, is the research area combining the bone biology and immunology. And my mentor, Dr. Hiroshi Takayanagi, created this field.
Created it?
Yeah, he created this field in 2000, 25 years before. Okay, because he's an orthopedic surgeon, and he took care of patients with rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease characterized by the inflammation in the joint and the bone destruction. Okay, so inflammation is mediated by the immune system, and bone destruction is mediated by the bone-resolving osteoclasts. So it's really important to combine the immunology with bone biology to fully understand the pathogenesis of rheumatoid arthritis. So based on this idea, my mentor Hiroshi developed or proposed the concept of osteoimmunology to investigate the interaction between the immune and bone systems. So why I became interested in this field? Your question is like that. So because the bone and immune systems are involved in most of dental diseases. For example, in the case of periodontitis, immune cells infiltrating into the inflamed gum and induce osteoclastic bone resorption, right? Same happens in the apical periodontitis or peri-implantitis, okay? And immune cells may also play a role in the bone regeneration during the periodontal surgery or osseointegration of implants, dental implants. And even in the case of orthodontic tooth movement, the low-grade inflammation at the pressure side may induce osteoclastic bone resorption. And the bone and immune system is also important for the oral cancer invasion into the bone, which I'm now working on. So, as you can see, we cannot understand the pathogenesis of dental diseases without the perspective of osteoimmunology. So that's why I became interested in this field.
I see. And regarding your understanding of this, the pathogenesis of the whole process and the way that diseases kind of develop, the department you mentioned was called a Department of Osteoimmunology, right? However, now you're the professor of biochemistry.
Yeah.
So how does that happen?
That's a good question. The biochemistry, especially in Showa University, our lab has been working on the bone biology. My former professor, 2 generations back, Professor Tatsuo Suda, is the kind of legend in the field of bone biology. He is really famous for his researches on vitamin D and also discovery of lung ligand, which is the cytokine inducing osteoclast differentiation and activation. And his fundamental discoveries contributed to the development of anti-osteoporotic drugs, which has now been widely used for the treatment of osteoporosis worldwide. So our lab, the Department of Biochemistry in Showa University, has long been working on the bone. So my research area was completely matched to the biochemistry lab. That's the second reason why I was selected as the professor of this department.
I see. That's very interesting. So did you have an understanding of... So you decided to move to Tokyo University to pursue your PhD. So you had this understanding of the nature of this research from your undergrad studies?
Yeah, exactly. Yeah.
And so at Showa University, they're very interested in preparing students for research.
So let me explain why I became a dentist, but became interested in research. Okay?
Yes.
So originally I was born into a family that has been running a dental office for generations. Okay, so my grandfather, grandmother, father, and uncle, all my family members are dentists. So, and my father was graduated from Showa University, and my uncle was an associate professor in the prosthodontics department in Showa University. So I entered the same school to become a dentist and to take over my father's clinic.
Was it because you wanted to, or was it family pressure?
Both.
Yeah, when many dentists, become, after their family. My father is also a dentist, and they tell me that they never pressured me to become a dentist, but I feel like I was pressured anyways. It was like you end up in the family business kind of.
Right. I didn't get the pressure, but when I was born, I was, lefty. I used left hand, but my father let me change to use right hand to, to get used to the dental system that is designed for people who use right hand, right?
Yeah.
So I didn't feel pressure, but I was kind of destined to become a dentist.
It was destiny.
Yeah. So destiny. So I feel destiny. So entered the dental school. But as I told you before, there's Dr. Suda, the legend of bone biology.
Yeah.
And at the time, he already retired from the school, but he gave us the special lecture when I was a second year grade student. And I was really impressed, inspired by his lecture, and became interested in the research. And after his lecture, I went to the biochemistry lab, and the next professor, Dr. Kamijo, my previous professor, was really happy and welcomed me to join his research group. And I did some research when I was an undergrad. Actually, I published 2 papers.
When you were undergrad?
Yeah.
That's interesting. That's very awesome. And something that usually hinders a lot of students from publishing maybe in undergrad is the English language ability. How were you able to, were you already good at English language at that stage, or did you have to learn it from that time? You had to learn.
At that time, yeah. My English, still I feel my English is not good, but at that time, I couldn't read, I couldn't write, I couldn't speak English, but I feel English is essential skill to become a researcher, so I learned by myself. Actually, I've never studied in abroad, so this is, I'm good at writing and reading, but hearing and speaking is.
I think you're doing just fine.
Still difficult for me.
You're lucky. Okay. So, sorry, we kind of digressed a little bit. One of the questions that I prepared was about your recent publication, the one that you published in Nature. Before we get into the paper itself, why is publishing in Nature quite difficult?
Why is publishing in Nature is difficult?
Yes.
Okay, so Nature, in the, Nature journal, the paper, the journal treats the paper from all the scientific fields. For example, like astronomy, if you find a new galaxy or something, this kind of paper can be published in Nature. Okay, so the Nature is a journal for people in all the scientific field. The point is that the paper that is interesting for other field people, only this kind of paper is acceptable in Nature. We call it conceptual advance. Nature has several sister journals like Nature Medicine, Nature Immunology, Nature Metabolism. We call this a specific journal. If your finding is very important in your specific field, the paper can be published in the sister journals. The sister journals is also very difficult, but to be published in Nature, the finding must be interesting for people in other research field. That's why it's really difficult.
It's really difficult. Yeah. And regarding your paper, can you, let us know about it, like in simple manner, that people can understand?
Our paper is related to the mechanisms of oral cancer progression. Okay, because I'm a dentist, I have been interested in the oral cancer progression process. Okay, and one of the most important features of oral cancer is that the cancer cells can directly invade the jaw bones, significantly worsening the patient's prognosis and quality of life. But the interaction between cancer and bone has been mainly studied in the context of cancer metastasis, in which prostate cancer or breast cancer or melanoma metastasize to the bone through the bloodstream. Okay?
Yeah.
This is very different from oral cancer invasion, because to invade the jaw bones, oral cancers must go through the periosteum, which is a membranous tissue surrounding the outer surface of the bone. So there must be some interaction between the cancer and the periosteum. That's the most different point between metastasis and invasion. But everyone has been working on metastasis, and no one has looked at the periosteum and invasion, right? In our paper, we analyzed the oral cancer patient, and also we newly established the oral cancer mouse models, and we found that the periosteum was thickened or expanded in response to the tumor proximity. Okay, and this periosteum thickening or expansion physically prevents cancer progression into the bone.
Because it makes a thicker physical barrier.
Yeah, right.
Right.
That's the unique point. The most important point is we found the anti-tumor mechanisms mediated by non-immune system. Right? So everyone knows that immune cells can fight against cancer cells. But no one knows non-immune cells can also fight against cancer cells. We found that this physical barrier mechanism and call this machinery as a stromal defense against cancer, providing the novel example of tumor host interactions. And this is actually the first evidence showing the importance of anti-tumor effect of non-immune system. That's why this paper went to Nature.
I see. Yeah, it was very interesting to actually know about. First of all, like a dental paper getting published in Nature is very, something that is, I think, makes all the dentists proud. So thank you for doing that. That's number one. And number two, like the role of the periosteum. Yeah, like you said, like I don't think like many people discussed it in the prevention of, or the role in fighting cancer, like kind of the role in the invasion. So yeah. How do you see the applications of this, research happening when treating cancer or when dealing with cancer cases or when screening for cancer?
Yeah, that's an important point. In clinics, there are two types of patients. Some patients have oral cancer that aggressively invade to the jawbone. But some patients, they have cancer, but tumor cells are really like dormant or don't invade to the jawbone so quickly. Now we are trying to, use our findings for the diagnosis of patients who will get oral cancer that quickly invade to the jawbone, or patients who will be resistant to cancer invasion into the bone. That's the first thing. And we also, based on our findings, I'm now getting the US patent to develop the drugs that make periosteum or other barrier tissues stronger to stop cancer progression.
Is this okay to mention in the podcast?
Yeah.
You already applied for the patent?
Yeah, it's
okay.
right.
It's fine. Yeah,
because people, the cancer kills people because they are progressing or metastasizing to other organs. If they don't progress, the cancer doesn't kill people. Right?
Yeah, it would be localized, so it can be managed locally.
Yeah, exactly.
Yeah. So in Yemen, I'm from Yemen, right? And I worked in the maxillofacial department where we received so many cases of squamous cell carcinoma. In the coastal region, there are many people who chew betel nut. And as you probably know, betel nut causes a lot of cases of squamous carcinoma, and the cases they come are just very terrible. So hopefully something like this will help, kind of treat these kinds of patients.
Yeah, and in our paper, we also show this system is also working in the case of osteosarcoma progression.
Also.
So maybe our drugs or our findings will be generalized to other cancer types.
So last question is how does the oral health help promote the general health of the patients? Especially, I think in one of your lectures, you talked about SRP and how does it relate to improving the general health of the patient. Can you let us know a little bit about that?
Yeah, this is probably the paper from Dr. George Hachishingari's lab in Pennsylvania University. It's not our paper, but
it's not your paper. Okay.
I like that paper. And 5 or 6 years before, he published a paper in Nature Immunology, which is also really prominent journal in the field of immunology. And I was really impressed with the figure 1 of the paper that shows the scaling and root planing increased the concentration of del-1 protein in the gingival clavicular fluid. Del-1 is a protein that inhibits inflammation and promotes bone regeneration. So del-1 is really good guy in the context of periodontitis, right? And my friend, Dr. Tomoki Maekawa in Niigata University, actually demonstrated that the local injection of del-1 protein significantly ameliorated the periodontitis in monkeys. And he also showed del-1 deficient mice failed to regenerate the alveolar bone during the resolution of periodontal inflammation. So del-1 is really important to, for the periodontal regeneration. The scaling root planing increased the del-1 expression in the periodontal tissue, suggesting that the scaling and root planing is more than just a cleaning, This is really providing key insights into clinical dentist or dental hygienist. So I love to introduce this paper for my lecture for clinical dentist and hygienist.
I think our associate here, Saito-san, he heard this information from you, and he was like, maybe including this question would be good, especially for the dental hygienists out there.
See.
Yeah. Well, thank you very much, Professor. And is there any other last words that you would like to tell, young dentists who would like to pursue a career in similar to your footsteps?
Okay, young dentist.
Yeah.
So for Japan or for
worldwide? This, including Japan,
Including Japan.
Yes.
So especially for Japan, please recommend this podcast to your friend or classmate.
Yes.
English is really important for young generations. So this is very good podcast.
Thank you very much.
It's really helpful for improving English. So
well,
that's my last word.
Okay, thank you very much. Appreciate you.
Thank you.